Good morning. I am Reverend Andra Cunningham, pastor of Greater Glory Mission AME Church in Greenville, North Carolina. I will be facilitating our session on strategies for coping with mental health issues, self-help. Our presenter this morning is Dr. Ifeanyi Walson, a psychiatry resident at East Carolina Viaduct Medical Center in Greenville, North Carolina. Dr. Walson is a North Carolina native who completed her undergraduate studies at North Carolina State University with a bachelor's in psychology and minor in biological sciences. She received her medical degree at Edward Via College of Osteopathic Medicine in Blacksburg, Virginia. She is currently a third-year resident in psychiatry at Viaduct Medical Center in Greenville, North Carolina. Her interests in psychiatry include mental health disorders and disparities seen in minority populations, psychotic disorders, and women's health and reproductive psychiatry. In the future, she hopes to work in a partial hospital program or integrated psychiatric and obstetrics clinic while continuing to advocate for policies that support women and minority mental health. As this is Women's History Month, where the theme is providing healing and promoting health, it is great to hear of Dr. Walson's interest in advocating for policies that support women and minority mental health. I present to you Dr. Walson.
Thank you, Reverend Cunningham, for the introduction, and thank you to the presiding elder for inviting me to speak about such an important topic. Hello all, my name is Dr. Ifeanyi Walson. I am a third-year psychiatry resident with ECU and Viaduct Medical Center in Greenville, North Carolina. So essentially what being a resident means is that I have completed 4 years of medical school and I am now working on training specifically in the field of mental health. As a psychiatrist, I treat a variety of mental health disorders from depression and anxiety to bipolar disorder and schizophrenia. I largely focus on managing the medication side of treatment, although I do get training in therapy as well. Mental health is something that affects everyone. It doesn't discriminate when it comes to age, race, sex, or social status. The prevalence of mental health has been highlighted in the last several years during the pandemic, while we have all been more isolated and a lot of our social and professional responsibilities have shifted. I tell my patients that treating your mental health is just as important as taking care of your physical health. Having a strong, healthy mind leads to a strong, healthy body and betterment in all areas of life. The top mental health disorders we see people diagnosed with are depression and anxiety. Over 16 million Americans suffer from depression and 40 million Americans suffer from anxiety. Common symptoms that we can see with depression are feeling down or sad, not being motivated to do things that you normally enjoy or need to do, changes in your sleep or your appetite, feelings of hopelessness and helplessness, and thoughts of suicide. With anxiety, we often see people worrying excessively about things that are out of their control, feeling irritable, having difficulty concentrating, difficulty sleeping, and sometimes even anxiety or panic attacks. The good thing is, however, that these disorders are highly treatable with medication, with therapy, and by developing healthy coping skills. So a couple of things that I think are helpful for people to practice when it comes to coping with anxiety and depression are, number one, engaging in self-care. And that can be whatever that means or is attainable for you. So self-care could look as simple as cooking a good meal, sleeping in, or on the flip side, waking up a little bit earlier in the morning so you can have a slow, quiet morning. Things like taking walks in the evening or dedicating time to reading or watching your favorite TV shows. As we are busy people and we lead busy lives, and we often have the responsibility of caring for others in our lives, this may mean putting up boundaries with others to ensure that you're able to carve out time for yourself. And as difficult as boundary setting can be, it is extremely important, as it is impossible to care for others if you're pouring from an empty cup. Exercise is something that we always recommend when it comes to improving your mental health, because exercise is known to increase endorphins, which are known as the feel-good hormone, and are also known as natural painkillers. It improves mental health by reducing symptoms of anxiety, depression, and negative mood, and also by improving self-esteem and cognitive function. Along with exercise, it is important to take care of your body just in general. So things like eating healthy, well-balanced meals, drinking plenty of water, getting 7 to 9 hours of sleep each night helps, as when you care for yourself physically, it will always positively impact you mentally. Things like staying away from illicit drugs and alcohol is also important. Alcohol is known to be a depressant, and many illicit drugs are known to negatively impact mood and cognition. What we've found in a lot of our studies is that people who struggle with their mental health actually self-medicate with drugs and alcohol, but these substances are masking and potentially worsening the underlying issues, so it's important to limit and abstain from substance use. Other coping strategies are things like meditation and practicing mindfulness. These are particularly helpful for anxiety. As anxiety causes people to worry and to stress more than normal, a regular meditation practice can help you get back to the present and get back to the here and now. And there are thousands of great guided meditation videos that are free online on YouTube, and they are a great start for beginning your meditation practice. There's also various grounding techniques that are also helpful as mental distractions. One popular technique involves using all 5 of your senses. So taking the time to identify 5 things around you that you can see, 4 things around you that you can feel, 3 things around you that you can hear, 2 things around you that you can smell, and 1 thing around you that you can taste. Another great grounding technique is something called box breathing, and it has also been helpful with dealing with anxiety. And how this works is you'll breathe in for 4 seconds, hold that breath for 4 seconds, breathe out for 4 seconds, hold it for 4 seconds, and then continue until you start to feel more at ease. Surrounding yourself with good people is always important, and whether that be family or friends or people from your church community, everyone needs good people who they can lean on in times of need. Having things to look forward to is equally important, and it doesn't have to be huge things like a big vacation or a big event. You can find joy in the mundane and in the everyday. So it may be as small as a quiet cup of coffee in the morning, or making a meal with a family member, or talking to a good friend on a daily basis. But finding these moments during your day that spark joy is critical when it comes to maintaining your mental health. Lastly, it is always important to know when to seek professional help from a psychiatrist or therapist or other mental health provider for more targeted diagnoses and treatment. If you feel like your mood is impacting your daily life or your ability to function, please do not be afraid to talk to a mental health provider who can guide you through managing your symptoms. Back in the 80s, there were a series of tornadoes that came through the eastern North Carolina area, and they destroyed property and they killed many people. And since we live in the Bible Belt and people were suffering and dealing with the aftermath of these tornadoes, they turned to their church communities for help. Mental health professionals were training clergy members at that time to attend to the needs of the people in the community. And now that we're dealing with the pandemic and its aftermath, I think it's something that would be reasonable to implement in our churches. For example, therapists and psychiatrists can educate leaders in the church in screening for mood disorders and suicidality, as well as in various therapeutic interventions that may be appropriate. We also have evidence that group therapy is beneficial for people who are going through similar stressors, so that is another option for our church communities. No discussion about mental health would be complete without touching on how we can all work towards preventing suicide. Per the CDC, in 2020, suicide was the 12th leading cause of death in America, with over 45,000 people dying due to suicide. Again, it has been a crazy time for all of us with COVID, and I don't think it has been more evident anywhere than our hospitals. We have seen an increase of people coming into the emergency departments with worsening depression, anxiety, and suicidal thoughts due to losing loved ones to COVID or just being isolated by quarantine. My job as a psychiatrist when it comes to suicide prevention is to talk to people, assess their current risk of suicide, and then act accordingly. Some things we look at when we're assessing for suicidality is the presence or lack of social support. So does this individual have children? Are these children in the home? Do they have close family or friends or a significant other for support? Does this person currently have thoughts of wanting to go to sleep and not wake up? Do they actually want to kill themselves? Do they have a plan to kill themselves? Any access to guns or other lethal weapons? The great thing is you don't have to be a trained mental health professional to help prevent suicide. Know the warning signs, check on your friends and your family members that talk about feeling like a burden, feeling hopeless, or the ones that you notice isolating themselves more, or the ones that talk about wanting to die or wanting to kill themselves. Offer them support and a listening ear, and encourage them to seek professional help. Don't be afraid to utilize crisis resources, including calling 911 if you feel a person has escalated to the point of acutely wanting to harm or kill themselves. There is such a strong stigma surrounding mental health, and I know many of us were raised to keep our private business private, but I always remind my patients and others when you're seeking out help, it is a sign of strength and not a sign of weakness. I will be sure to pass along some resources for finding psychiatrists and therapists and other mental health providers in North Carolina, as well as crisis resources, including the number for the suicide prevention hotline. Again, thank you to the presiding elder for having me, and I hope this talk was useful for you all.
Thank you for such an informative and resourceful discussion, and for bringing to our awareness the need for the faith community and the mental health community to work together to support those in need. If there are any questions, please place them in the chat and Dr. Walson will respond to them after this session. Thank you very much for joining us this morning.